Hello, this video will show how to administer an enema and how to perform colostomy care. An enema is a solution introduced into the rectum and large intestine. The action of an enema is to distend the intestine and sometimes irritate the intestinal mucosa, thereby increasing peristalsis and the excretion of feces and flatus. Types of enema include a cleansing enema, which is intended to remove feces in instances of constipation or impaction, and also to prevent escape of feces during surgery, and to prepare the intestine for certain diagnosis tests such as X-ray or colonoscopy. A carminative enema is primarily intended to expel flatus. The retention enema is introduced oral medication into the rectum and sigmoid colon, and it helps to soften feces and to lubricate the rectum and the anus. A return flow enema, also known as Harris flush, is used to expel flatus and to relieve abdominal distension. Prior to doing the procedure, ensure to do proper assessment. Identify the type of enema and the purpose. Go through the patient's history to ensure that there is no contraindication for the type of solution that will be used. Assess the patient's last bowel movement. Assess for fecal impaction. Assess whether the client can use a toilet or needs a Komodo. Assess the patient knowledge of the procedure, as well as assess any vital signs as indicated. Next, gather all your equipment. Identify your patient using 2 protocols and explain the procedure to your patient. Then get ready to start your procedure.
Good morning. My name is student nurse Kendra Today I'll be your nurse. I will also be administrating your enema. The doctor has ordered since you have not been passing stool for a couple of days. What is your name? Okay, Mr. Smith. Is that okay? Thank you. I'll go and get my stuff and come back right now.
Assist patient to a lateral position with the right leg as acutely flexed as possible.
Mr. Smith, can you please turn to your right side? Thank you. Bend your legs. Thank you.
Place disposable water pad under the buttocks. And hang enema administration set on the IV pole and prime tubing and clamp. Lift upper buttock to visualize the anus and lubricate the tubing. Insert the enema tube slowly into the anus, 3 to 4 inches toward the umbilicus. Do not force the tube into the anus. If resistance is met, ask the patient to take a deep breath and slowly run small amounts of solution into the anus.
Please take a deep breath.
Remove the tube and check for fecal impaction. Reinsert the tube in direction of the umbilicus. If patent, continue with administration. Rinse the solution catheter no higher than 30 cm above the rectum and open the clamp. Administer the fluid slowly. After all the solution has been instilled, the client cannot hold it anymore. Close the clamp.
Okay, thank you.
Remove the enema tube from the anus and place it in a disposable towel as it is withdrawn. Encourage the client to retain the enema 5 to 10 minutes or 30 minutes for retention enema.
Okay, sir. Fix your leg now. Do not move for 5 to 10 minutes.
Place the bedpan for bedridden patient and assist to defecate.
Step up.
Remove the bedpan.
You're done, sir? Okay, I'll remove the bedpan for you now.
And assist the patient to tidy.
Raise up.
Replace the pampers.
Pampers for you.
Doff your gloves and perform hand hygiene.
Thank you very much, sir.
After you have performed hand hygiene and cleaned up your equipment, evaluate the following. Any fecal matter pass, the patient's tolerance to the procedure, any deviations from normal, assess the pulse sounds, and the patient's increased comfort or relief of abdominal distension. Then document the following: the type of enema, the purpose of the enema, the length of this time the solution was retained, the characteristic and consistency of the feces, the patient's tolerance to the procedure, any unexpected outcomes and measures taken to remedy the problem, and your legal signature. Moving on to colostomy care, let's talk about what a stoma is. A stoma is a surgically created opening of the colon into the abdominal wall through which digested food passes. It may be temporary or permanent, and the pouch is worn over a colostomy to collect the stool that passes through the stoma. A colostomy pouch is normally emptied 1 or more times daily, and the pouch itself usually needs to be changed every 4 to 6 days. And the stoma and surrounding skin need to be kept clean, dry, and sanitary all the time. The purpose of a colostomy care is to maintain hygienic needs and promote patient comfort, to provide data about the condition of the stoma and surrounding skin, to provide an opportunity for health teaching and prepare the client for assuming self-care, and to promote positive self-image and comfort by maintaining clean, odor-free environment without peristoma skin excoriation. Prior to starting the procedure, ensure to assess the use appliance for leakage of stool and function, assess the patient's status and stability, do general physical assessment of the patient, assess the site of the stoma, clarify if the patient has any allergies to tape, gauze, or any cleaning solution that will be used. The list of equipments that will be needed for colostomy care: gather our equipments, carbolize your trolley, perform hand hygiene, and get ready to approach your patient to start the colostomy care. Hello, good morning. My name is Nurse Rocio. How are you doing today? Okay, can you please tell me your full name and your date of birth? Okay, Mr. James, so today what I'm going to be doing is I'm going to be cleaning your stoma and replacing your bag, okay? Is that okay if I go ahead and do that? Okay, so I'm just going to wash my hands and then I'm going to come back with my equipment, okay? Okay, I'll put on my gloves. Have you been feeling any discomfort today, Mr. James? No? Okay. Well, throughout the procedure, if you feel anything, just let me know, okay? No, stop. Okay.
Place drip over client. Place absorbent pad or towel under client. Observe placement of stoma. Empty pouch into measuring, graduating, or bedpan if or needed to quantify.
It's going to be emptying it out, okay?
Remove pouch by pushing against skin as backing pulled from the skin for counter pressure.
Remove it now. It's not feel any pain.
Pouch is discarded in plastic bag. Output is measured. Skin and stoma is gently cleaned with warm water and soft cloth.
Okay, Mr. James, I'm going to be cleaning your stoma.
Skin is dried with soft cloth. Tissue is kept available if stoma function, while pouch is off.
Okay, Mr. James, everything looks good.
Observe client peristomal skin for signs of erythema, excoriation, ulceration, and fistula formation, and stoma for change in size and color. Stoma should be beefy red and moist.
Okay, everything looks good with your stoma, Mr. James, okay?
Inspect the client's abdomen for firmness, softness, contour, scars, and incision.
Where are we checking your abdomen? Everything is good? Okay.
Measure stoma at the base with a measuring guide.
Are we measuring your stoma? Alright.
Trace measured pattern on pouch. Cut pouch to pattern, making sure opening is large enough, at least 1/4 inch, to encircle stoma without pushing on edge. Apply a ring of skin barrier paste to the opening of the pouch.
Alright, Mr. James, are you ready?
Remove paper from the outer ring. Center the applied pouch to clean and dry skin. Smooth edges of adhesive to skin. Close and secure end of pouch with a tail closure if applicable.
Okay, Mr. James,
Check for adhesive of pouch if needed extra support.
your bag is good, everything is good, it's properly placed, okay?
Doff gloves.
I'm gonna be removing this. Okay, Mr. James, that was good. Everything is good with your stoma, no problems, okay? Thank you. After you've performed hand hygiene and cleansed all your equipments, evaluate the patient's tolerance to the procedure, the color consisting and amount of fecal matter, and evaluate the presence of skin breakdown around the stoma. Then, document any increase in size or color change of the stoma, the presence of skin irritation or erosion or discoloration of the stoma, the appearance of the peristomal skin, the amount and type of drainage, and the patient's reaction to the procedure and the client's experience with the ostomy. And that's the end of the video. All of the information can be found in the Culture and Herbs Fundamental of Nursing 8th edition in chapter 49. Thank you, and I hope this video helped you.